I am Gene Kimball, the Deputy Public Affairs Officer here at the Dole VA, and I'm going to be your moderator for today's town hall. So we're going to provide updates for you today on VA programs and services, followed by fielding questions, but let's review some housekeeping notes first. So next slide, please. Please be aware that today's session is being recorded. I just hit the record button, and so others may view it at their convenience. If you have questions at any point during our briefing, we encourage you to submit it via the chat window at your earliest opportunity. Also, at the end of our presentation, guests can unmute their mics to ask questions. When asking questions or making comments, please refrain from sharing personal information during the session, whether it be your personal information or that of a comrade or a friend. We do want you to be aware that the link to this town hall has been shared publicly, meaning that anyone could be looking in and watching what we're discussing today. Next slide. So Mr. Michael Payne, Medical Center Director, joined the Dole VA in July of last year, and since then he's devoted himself to furthering the mission of providing world-class care to the veterans that we serve. He's here this morning to address a few hot topics with you. Sir?
He's still in chat and chew. He should be over shortly.
Okay. So what he is involved in right now is a chat and chew that we hold on a weekly basis here at the Dole. It allows our staff the ability to communicate directly with Mr. Payne, our Medical Center Director, ask questions, bring forward thoughts or ideas. And have just general discussion. It's usually attended by 150 to 200 members of our staff who provide great questions, provide great ideas, bring thoughts to mind. And to be honest with you, there have been times that there haven't been a lot of questions brought forward. And so Mr. Payne is very personable, and we'll just start the conversation going about what people have done over the weekend, what plans are coming up, what people have done over the past weekend, and it brings together staff on a more personal basis. And so it's been real refreshing to have that type of leader here at our facility for the past year. My understanding is he's on his way. Some of the topics that were happening today during the chat and chew, there were some questions about some potholes in our drives, and requests to have those worked on, as well as some signage issues that I know are in the works for next year. I believe Ms. Miller, our associate director, I'm sorry, is in charge of that program, and they have plans for overall facility signage work next year. So looking forward to that. Ms. Reyes, you might go to the next slide. Okay, I believe Mr. Payne has joined us. So Mr. Payne, the floor is yours.
Okay, good morning, everyone, and welcome to our town hall. I have a few updates that I'll share with the group this morning, and we'll also have an opportunity for any questions or answers at the end of the session. Next slide, please. Okay, thank you. So, as I mentioned, and I have mentioned before, I firmly believe that everyone knows that what we do here at the Dole is provide, at least strive to provide, outstanding care to our veterans. And mental health care as well is a top priority for that. I oftentimes, however, wonder if you all know that all those things that take place behind the scenes providing that health care. And today, I'd like to share just a few of those activities with you as well as have some of our staff also provide you with some additional information. And the first item, as you'll see on the slide, speaks to the City of Wichita partnership. And in 2020, the Dole VA partnered with the City of Wichita United Way of the Plains and Wichita Transit to launch a pilot program called Veterans Ride Free. It was designed as a 2-year pilot program, and since that time has proven to be very popular and a beneficial program for our veterans. This morning, Mr. McFadden, our Chief of Transportation Service, will tell you a little bit more about that program. Next item I'd like to speak to you a little bit about is our VA Secretary, Dennis McDonough. Our VA Secretary, Dennis McDonough, visited Wichita on June 27th for the VBA Regional Office ribbon cutting and open house event. Secretary McDonough was joined by Kansas Senator Jerry Moran, and they provided words of appreciation for the many efforts of the VBA Regional Office staff and our staff here at the Dole VA Hospital. Our executive leadership team and our visiting 15 director, Dr. Hall, was able to meet with the Secretary and Senator Moran. And I'd like to share a little bit of what we discussed. So first and foremost, Senator Moran is really thrilled with the outstanding care and the delivery of that care that comes out of the Dole healthcare system. Senator Moran was very complimentary of the staff and the efforts to provide veteran-centered care on every encounter. Senator Moran also mentioned that without fail, he routinely comes to the Dole VA for insight, for perspective, and for comparison. So he oftentimes compares the Dole VA to other healthcare systems. And that is a good place to be. Senator Moran and I also shared in some discussions surrounding the same, along with what I just discussed for the Secretary. So the Secretary and the Senator were very complimentary of providers that were specific to staff experience, VBA staff that are also enrolled in our veteran healthcare system. And he gave a special shout out to one of our physicians via email. And that was a really great news story where the Secretary sent a personal email to one of our providers, and that typically does not happen every day. So we're very thankful to have our primary care staff, our specialty care staff, and our mental health care staff and administrators as well as we go about our business of providing outstanding care and support to our veterans, their caregivers, and their families. Finally, Senator Moran also continues to give us the charge on ensuring that veterans receive access to care in the community when appropriate, just as much as our veterans are choosing the VA care. We also hosted the Senate Veteran Affairs Committee staffers from Senator Moran's office here at the Dole VA a few weeks back. Members of our executive team, as well as other leaders, met with that team to provide updates on several programs and services. Specific information was provided regarding our community care program. We updated our congressional staffers on our substance abuse residential rehabilitation treatment facility and program. We also provided tours of certain areas throughout our facility, which have been undergoing upgrades and construction projects. And we ended the tour in our substance abuse residential rehab facility, where our staff were able to discuss the benefits of the program and answer questions for the congressional staff to take back to Senator Moran for his work on the Senate Veteran Affairs Committee. So all in all, our senators, Secretary McDonough, and the Senate Veteran Affairs Committee staffers were very pleased with the care that we're delivering to our veterans. I assured the Secretary and the Senator that we will not rest in our pursuit to afford every single veteran in the state of Kansas that wants care at our system that care. That mental health care will be a priority for us, that we will continue to find balance with our community care spending and our overall facility spending, and that more importantly, veterans are choosing the Dole VA at a rate higher or equal to our community partners on every encounter. Next slide, please. Okay, I want to talk a little bit about our women's health program. Recently, our women's health program coordinated their annual veterans baby shower, where veterans who had a child within the past year or were expecting a child could come to the VA and select from a large collection of donated items. These items included things such as car booster seats, bassinets, strollers, and swings to smaller items like diapers, clothing, and hygiene products. In fact, the Dole VA had received over $35,000 worth of donations that were provided to more than 70 families during this year's baby shower. That is a big lift and a huge accomplishment for our team, for all of our stakeholders that were involved, and providing that to our veterans that perhaps would not have had access to it otherwise. So thank you to all of our staff that joined in that. Thank you to all our donors that donated for us. Thank you to all our veteran service organizations as well that's continuing to support us and being great partners. And those families are better served because of it. Lastly, this morning, I'd like to briefly touch on our budget and our FTE status and discuss how that's comparing with other visits. Bottom line is you've likely heard that most of the VHA is in a very peculiar budget situation and budget environment, like never before. We've been tasked to balance our budget down to what we're calling functional zero, which means that every facility will have their share of a deficit to clear, and every facility will have their share of FTEs, which are staff, that we have to basically decrease in our overall operating plan. And the Dole VA's portion of that is about 35 FTE left. So we're still about 35 FTE that we have to clear to get down to our functional zero, if you will, which is our pay period 20. So September of 2023 goal. The secretary and the undersecretaries have set requirements for every VHA facility, and they all have varying levels of budget gaps they need to cover and FTE gaps. And this is a result of us doing an extraordinary amount of hiring during the years 22, FY22, FY23, and even to some extent FY21. And so as a result of us having an extraordinary hiring year and all these different onboarding events that we also had during that time frame, obviously we were also dealing with the pandemic, so some of that was warranted. We are now trying to right size our overall budget to return back to a baseline. Same thing with our FTE. One commitment that you have for me is that we will not compromise on veteran safety or on veteran care while we're balancing our budget and our FTE goals. Veteran care, veteran safety, and veteran quality will remain the highest priority for what we do in our healthcare system. And that means even if we exceed our budget goals, meaning that we don't meet our goals and our deficits, or even if we don't meet our full FTE goals, veteran quality, veteran care, and veteran safety will not be compromised. I want to be very clear on that. We're here to serve veterans at the Dole VA. We're here to ensure that our staff serve in safe environments. And to do that, we're assessing all aspects of where we can reasonably make adjustments to programs, where we can reasonably identify inefficiencies across the system, and where we can continue to partner with our stakeholders and our community leaders as well in order to meet those goals for our veterans. So thank you again for joining us. Thank you for what you do in support of our veterans, and it's an honor and privilege to serve alongside you. I'll turn it back over to Mr. Kimball. Thank you.
Thank you, Mr. Payne. We're so glad you're here with us. as a leader here at the Dole VA. As I said before, Mr. Payne started, he's very personable. He's also a great leader and has great expectations for this facility. And it's been a pleasure. So as Mr. Payne alluded to, Dole VA is active throughout the catchment area, informing veterans of the services available to them. Tamara Thomas, who is our outreach coordinator, is here to provide some information. Tamara?
Thank you. Thank you for giving me the opportunity to share some highlights and recent changes to our healthcare system and outreach efforts. Recent changes were made to the PACT Act established in August of 2022 to Section 103 on March the 5th of this year. This amendment included expansion of healthcare eligibility for toxic exposed veterans to include reserve and guardsmen who participated in a toxic exposure risk activity otherwise known as TARA. While serving on active duty for training, or inactive duty for training, whether it be home or abroad. Under those authorities, those veterans who were never deployed but were exposed to toxins and hazardous materials by working with chemicals, pesticide, lead, asbestos, certain paints, nuclear weapons, x-rays, and more, they will be eligible to enroll and can receive hospital care to include mental health care, counseling, medical services, and nursing home care through the VA. Our outreach collaboration involves several agencies, including Veterans Benefits Administration and many of our community partners, such as local businesses in the aircraft industry. This has made our program very successful at reaching many of our local and rural veterans. Some of our outreach efforts includes vet-to-vet coffee with veterans at their assisted living residence, and even enrollment and benefit fairs in our rural communities, such as the Salinas Masonic Temple, where we served over 125 veterans at that event last year. August 18th would be one of our upcoming events. We will host a Summer Vet Fest, VA Healthcare and Enrollment, at the Riverfront Stadium at Windsurge. For more details on that, please visit our webpage. I hope to see you there, and thank you for your dedicated service.
I think we've got one more slide for you, Tamara.
The next slide is going to go, if you want more information on the PACT Act, there are QR codes that will give you more details, and the new March 2024 update to the terror exposure sheets would be available on there. Thank you, Jean.
You bet. Thanks, Tamara. If you haven't met Tamara, she is everywhere in our community and everywhere in all of our communities that are part of the catchment area for Dole VA. So she does a great job. Veterans should expect to receive quality health care when coming to the VA. Dole VA's quality scores are very good, and that's not by accident. Leo Longson is here this morning to provide information on our journey to continuous improvement. Leo?
Good afternoon, everybody. My name is Leo. Just a quick background on myself. I was a Air Force medic for 12 years active duty, and then after that, I was a firefighter here in Wichita Fire Department, and now I am your HRO lead along with Chris Graves. So I am a veteran, and I am very, very passionate of the care that I receive and also that we give as a facility. So next slide, please. But what I like to do before I even start getting into this information that can be pretty eye-opening, I like to start with a dad joke. Okay, so, and if you guys have any great dad jokes, please throw them in the chat because I like to, increase my repertoire, right? So today we're gonna focus really on pirate jokes. Okay, so here's the first dad pirate joke. What did the pirate say on his 80th birthday? What did the pirate say on his 80th birthday? Well, he said, "I am 80. I'm 80 years old. I'm 80. Okay, that's all you're gonna get today. All right. So I appreciate that. I hope that, hey, I got one laugh. That's all that matters. If you guys have any great dad jokes, please throw them in there. I would really, really appreciate it. Okay, so with that being said, if you look at the healthcare facilities in the U.S. and just healthcare in general, based on the BMJ, which is the British Medical Journal, it says that as many as 400,000 U.S. deaths per year involving medical error. I mean, think about that. That is almost the whole entire city of Wichita dying every year because of medical error. And when we talk about this, we're talking about the whole entire U.S. healthcare industry. It says 1 in 10 patients suffer an adverse event during hospitalization. 1 in 10. That just does not make any sense. 1 in 10 suffer a really adverse event, right? 50% of surgical procedures involve a medication error and or an adverse drug event, and 4,000 surgical never events occur every year. So what is a never event? I just heard somebody today while I was doing rounds saying that, my dad was going to get some kidney stones removed, and they're like, okay, we're going to go on the right side, and say, no, it's on the left side. And then the doctor says, are you sure it's on the left side? Because we got the right side. He was like, no, it's on the left side. So he looks at his notes and was like, oh yeah, you're right. It is on the left side. So these things occur, these happen. All right. And what is the VA doing to make sure that these things do not reach our veterans? Next slide, please. Okay, so what is a high reliability organization? So I am your HRO lead, and HRO stands for High Reliability Organization. So an HRO experienced fewer than anticipated accidents or events of harm despite operating in complex, high-risk environments. So we do a lot of risky things, right? Opening people up and messing with their insides or giving medication that can adversely affect somebody, that is a very complex task, right? So a lot of people think that, hey, the goal of what is the goal of an HRO? And a lot of people think that if you want zero harm, you have to have zero mistakes. Well, you guys can just raise your hand or react. How many of you guys have never, or who makes mistakes every day? Okay, we all make mistakes every day. So if you are looking for somebody to say zero harm is equal to zero mistakes, not going to happen. We are all going to make mistakes. So what do we do with those mistakes? Go ahead and go to the next slide, please. So what do we do? Well, we developed, or actually we didn't develop, but we adopted crew resource management. So crew resource management started in NASA. So back in 1979, and I don't know if you remember in the 70s, one of the things that NASA were doing was that they were putting people in a tube that has fuel in it, and they shoot them up in the air, right? So when we shoot these people up in the air, bad things can happen. And they were realizing or noticing that they were having a lot of catastrophic failures. So what did they do? They started crew resource management, and they identified a human error as a main cause. So when you're like, okay, so human error is the main cause because we all make errors. But what are they? They talk about failures in communication, failures in decision making, and leadership. So those are the three things that they focused on, and their safety rating pretty much skyrocketed. Next slide, please. Okay, so crew resource management also talks about the airline industry. So everybody in here is probably or have flown or know somebody who has flown in an airplane. Do you get in an airplane and say, man, I hope we get there? Anybody ever thought that every time they step into an airplane? And if you think that, would you get in an airplane? You probably would not. So crew resource management is an application that the airline industry pretty much started or adopted as well. Crew resource management started in 1981. They changed the behaviors and attitudes of the people, in part responsible for exemplary safety record. Okay, so let's go to the next slide, please. So if you look at this slide right here, the effectiveness of CRM, between 1970 and 1980, they were like, okay, we're crashing planes, right? And this graph pretty much shows you how many airplanes per million crashes, right? So back in the early 70s, they were crashing 10, 12 per million. You're like, 10, 12 per million? That's pretty good odds, right? I don't know if you're in those 10 or 12 airplanes per million, you probably wouldn't think those were good odds. So what did they do? They started automation. And when automation started, they were going from 12 flights per million crashing and knocked it down to about 6, maybe 7, right? They're like, okay, this is good, but we need to do something else. What else can we do? So they adopted crew resource management from NASA. And as you can see, they adopted it in 1980, 1979, 1980. And for 10 whole years, they saw zero change. They're like, oh, this thing's supposed to be the best thing since sliced bread. How come we do not see any change? Well, what they noticed is that the people were doing it, but they were buying in on it. So when you look at 1992, 1994, about 10 to 12 years later, the culture changed where people actually bought into crew resource management. And you know, you guys ever have those old crusties that says, oh, we've been doing this for 35 years this way, we don't need to change anything? Well, a lot of those people either just retired or they just left the industry or whatnot, and you got all these new blood coming in saying, you know, we're all about cultural change. So as you can see, by 2004, they've knocked it down to 1, sometimes 0 airplane flights per million crashing because of the culture change. So that is what HRO is trying to do. And guess what? HRO requires every single person in our facility to buy in. Next slide, please. All right, so I'm just going to show you this quick video. Go ahead and play it for me, please, sir. I don't think we're hearing the sound either, but that's okay. No big deal. And I don't know if it's going to play. All right. So as we're watching this, everybody knows who the Thunderbirds are, right? These guys are amazing pilots, able to do amazing maneuvers. And of course, I would say we could probably argue that they're the cream of the crop, right? Or at least some of the best of the best. So, okay. Oh, okay, here we go. All right, now we got a little. And as you can see, when they're talking on the radio, they get pretty excited.
Knock it off. Thunderbirds, knock it off.
Okay, let's go and go to the next slide. All right, so how did this happen? So the site of the air show was Mountain Home Air Force Base in Idaho, and the home of the Thunderbirds is, guess what? Nellis Air Force Base, where I'm from, Las Vegas, right? So what happened was when they went to do this specific maneuver, when they do this maneuver in Nellis Air Force Base, it is only, it is 1,000-foot lower sea level than Mountain Home. So apparently this specific pilot forgot to change his altimeter, saying that he needs to do this maneuver 1,000 feet higher than what he usually does. So they call this a cognitive slip. Okay, so going, oh, by the way, the pilot survived. Next slide, please. Okay, so what do airline industries do, and what do we do in the Robert J. Dole VA? Okay, so these are the things that we try to, let me not say try, we do constantly to make sure that we provide the best, safest care possible. So we are currently incorporating lessons learned from airline and nuclear industries. We create a culture of safety. We encourage veterans to provide valuable feedback. Let us know what's going on. Let us know. I'm a veteran, so when I see something not safe or not right, I will speak up, because guess what? This is where I get my care. We improve daily operations and processes. We increase interdepartmental collaboration, standardizing procedures throughout the entire facility, focusing efforts on the needs of both veterans and the staff. And of course, healthcare is a team sport. It used to be a one-man sport where the doctor pretty much did everything. Well, guess what? It is no longer that. And we all know the more eyes we put in a project, the more we can see, more perspectives we put on it, the more likely it will succeed. Next slide, please. All right. So I guess that was my last slide. Sorry about that. So I just want everybody on the call to understand that we are doing our best. We are continually improving our processes. And if anybody on the call has any ideas of how to improve our processes and provide the best care possible to our veterans, please reach out, and we would truly appreciate it. Thank you so much for listening.
Thanks, Leo. Appreciate the presentation. Sorry about the video. It's just part of our system. Sorry. The results of our quality improvement initiatives are reflected through satisfaction scores gathered through our survey process, and other times just through conversations between our veterans and our staff. Just like Leo was saying, if you have thoughts or ideas, get with us to provide that information. Amber Philbrick, who is our medical surgical nurse manager, is here this morning to discuss our inpatient experience scores. Amber?
Hello. If you want to go to the next slide for me.
So our inpatient experience scores, like he said, I'm the nurse manager over the med-surg unit, but I'm also the team lead for our inpatient experience team. So we look at all of the data for our inpatient experience surveys and determine where we can improve and trying to make a better experience for you as our veterans. This data is pulled from surveys that are sent to all of the inpatient patients as they're discharged. So if you were admitted to our facility upon discharge, it's approximately 60 days after you would get a SHEP survey in the mail. We'd appreciate if you fill that out, sent it back in. That's how we know how we're doing and learn to like which areas of opportunity we have and where to improve. So to start, I just wanted to show you some of our current scores. Our overall hospital rating is 80.5 compared to the national average. The national average for the overall hospital rating is 71.5. So we're doing phenomenal as our overall hospital rating. For our communication with nurses, we're at 81.8. The national average there is 78.4. And then for communication with doctors, we're at 80.2. The national average is 79. And then for our care transitions, this score tends to be a little lower as the number indicates. We are at 59.3. The national average there is 55. For our overall hospital rating and our care transitions, that's what this box over here on the right shows our metrics. The metrics takes all of the VA facilities and essentially splits them into 5 separate quintiles. Just showing our ranking for where we compare to the other VAs throughout the nation. For our care transitions, we've improved to the 2nd quintile. So we're in the 2nd tier of VAs. And then for patient satisfaction, we're currently in the 1st tier, which means we're currently 25th overall for the patient experience for our inpatient units. I'll have you go ahead and go to the next slide for me, Pete, please. So some of the things that we've implemented for just to help improve our care that we provide to you while you're inpatient. We've implemented our Commit to Sit initiative. This involved us placing folding chairs in each of our patient rooms. And so it encourages our doctors and physicians, really all medical providers, to sit when they have conversations with you as a veteran. We want to make sure that we are taking the time that you understand the things that are going on and allowing for questions and making sure that we're answering all of those questions and that you feel comfortable with the information we've provided before we leave that room. So this initiative was not just for physicians, it's really for all medical staff. So case management, social work, nursing, pharmacy, really anybody. We want them to be sitting with you, just discussing the things that are going on and just ensuring that you understand all of a lot can happen while you're in the hospital. So we want to make sure you have a good understanding of that. On the medical surgical unit, we have initiated bedside shift report. What that means is that during shift changes, so typically our nursing staff change shifts or change staff twice a day. So we have shift change at 7 in the morning and then again at 7 in the evening. So those nursing staff or nursing assistants, they'll come into the room to do their shift report. This helps include you in the discussion of what is going on in your care. It helps you be informed with the information that the nurses are informed with. Lets you know if you have a new medication, if you have a procedure scheduled that day, and then it allows you to be introduced to the nurse that's coming on to care for you that next shift. With that, we've also implemented purposeful rounding. This is just a way to ensure that we've covered all of your needs while we're in the room assisting you. Instead of just asking, is there anything else you need? We're going to have special prompts that will help make sure we're addressing all of your concerns. We'll ask if we can help you to the bathroom. We'll ask, how is your pain? See if there's anything we can do, provide medication or help reposition you to make you more comfortable. We'll make sure that everything that you might need is within reach of you. So your cell phone, your call light, the TV remote, maybe Kleenexes or a drink. So that just helps that you don't have to push your call out as soon as we've left that room because you might need help to the bathroom. Or maybe you have pain and we didn't ask while you were in there, and then you'd have to push the call out and wait for us to come back. So it's just helping ensure that we're meeting those needs as you have them. Another thing that we've put into place is educating all staff on the teach back method. This is just a way to help ensure that you understand the things that we are teaching. Oftentimes, physicians and nursing, we get used to speaking medical lingo, which oftentimes people aren't as familiar with. And so the teach back method is just following up on the things that we've taught to ensure that you've understood the information provided. So if we're giving medication education, it's asking tailored questions to make sure you know what that medication's for or what those side effects are. And we do this throughout our practice. So it's not just pharmacy and medications or nursing and medications, case management, social work, PT, OT, respiratory, all of our staff will be trying to make sure that you're understanding the education provided. And then lastly, not necessarily something we've implemented, just something we routinely continue to do. Our inpatient experience team meets monthly. We look at the data, but then we discuss any issues or concerns that we feel like are impacting you. We want to make sure that we're providing the best care possible. And so we will go through each concern and see how we can, what processes we can put into place to ensure that we're performing better in the future or ensuring that we're not having those same concerns down the road. Thank you.
Thanks, Amber. Appreciate that. I hope everyone can see that, Leo's presentation talking about the HRO process leads into our inpatient satisfaction scores, which, as Amber showed, are very good. So VA works very hard to make services available to veterans where they live. Telehealth has been a significant factor in bringing advanced health care to veterans in more remote areas. Jesse Colmy from our informatics department and Kimberly Gillette, respiratory care are here to discuss our telespirometry services. Jesse?
All right, thanks, Gene. Well, if you go to the next slide, please. So what is telespirometry? Spirometry is a new service that we offer to all of our outlying VA clinics that may not have a dedicated respiratory team. It's an asynchronous service that utilizes our telehealth store and forward modality. This means that you as the veteran are able to come into the clinic and have a pulmonary exam done. Once that's complete, the results of the exam are sent directly to the respiratory team here in Wichita. Once those results are interpreted by the team, they're then communicated back to you and a treatment plan can begin. Next slide. And here you can see a list of all the participating clinics that are now offering this spirometry service, along with all their contact information. So if you live within one of these clinics and are in need of this kind of a service, please reach out and we can try to get you scheduled. Next slide. And now I'll turn it over to our Chief of Respiratory Therapy, Kimberly Gillette.
Good morning. Some of the services available are to do the spirometry testing, and this just includes different ways of breathing tests to determine if you have a lung disease. A couple examples might be COPD or asthma. Spirometry measures how much air you can breathe in, how much you're getting out. We might also do what we call a breathing treatment, like an inhaler, a bronchodilator, and then repeat some testing to see if there's any change in your airways or if you might benefit from the medication. And then we also do lung gas diffusions where we can measure the amount of oxygen and or other gases that transfer from your lungs to your blood. Next slide.
Thank you, Kimberly. Here we have just a few telehealth resources, including a direct line to the telehealth team here in Wichita, as well as a few useful links to other telehealth services. Some include the VA Video Connect and Digital Divide services. And I believe that's our last slide. So I just want to say thank you for allowing us to provide you that information. If there's any questions, please feel free to put them in the chat. Thank you.
Thank you.
Thanks, Jesse and Kimberly. Appreciate that information. So making services accessible to our veterans doesn't stop simply at providing services in remote locations. Oftentimes, it's simply getting a veteran to an appointment or a veteran getting to an appointment. A great idea was put into motion that's benefited many veterans. Charles McFadden, Chief of our Veteran Transportation Services, is here to tell us a little bit about that. Charles?
Good morning. Welcome to the Veterans Ride Free discussion about our program. Mr. Payne already touched briefly on some of the points there in the beginning. And I think what's important to point out is that this program was actually started during a pandemic. So that speaks volumes to all those involved in getting this off the ground with our partners with United Way and Wichita Transit. It was started as a pilot program in July of 2020 by our previous chief, Mr. Snap. In 2022, the pilot ended and then became permanent, and it extended to 2024. Last month, July of this year, we extended the program again with our partners in United Way and Wichita Transit to July of 2026. So needless to say, the program will be here for quite a while. Our department, our VTS department, is also a member of the Wichita Transit Advisory Board. We meet with them at least once a month, and we go over, things about transportation and how it affects those in our city. So I think that's speaks volumes for our department. Next slide, please.
My name is Frederick Allen Wagner. I was in the Army for 4 years, 78 through 82. I refueled aircraft.
This here is a place for mental patients as well as the homeless veterans. I've been homeless for 10 years after I went through a bad divorce. So they're here to help everybody, really, but you got to help yourself first. Hey, the bus is neat. It's like it empowers you where you don't have the ability to do things when sometimes you got to take advantage of the things and do it yourself to make yourself do things, First, I was kind of nervous, about getting lost or this or that. Then I just started doing different things, with it. So this tells me the times where I can get on, what time they'll be there. So that way I got to be out, set down in the hot sun. Going to the VA on a Q-Link's all right, because I know I can go places where I couldn't before because I don't have any money. You get on any bus and show your ID and you're good to go.
My name is Tina Heim. I was in the U.S. Army. My job was nuclear, biological, radiological, and chemical warfare specialist. Being able to ride the bus for free, it really has opened up a lot of things. I feel like I'm able to get better care at the VA just because it makes it so I'm not having to limit myself to certain amount of visits at the VA each month. Because now I can make more appointments, get better care, and, just being able to shop, do different activities, like get to American Legion, because I love to go there and hang out with other veterans. Being able to ride for free has opened a huge amount of things. It is a pleasure serving veterans because they're very grateful, very kind, respectful, just all around happy to be able to have a ride out to the VA.
My name is Kevin Hicks, served in the U.S. Army. This is Convision, and I drive a forklift here on parts picker. You get these orders and you just go around and pick the parts from proper bins and locations, set them up and get them checked out. I didn't know that the Wichita bus system was actually free for veterans. When I realized how easy it was to get here and how convenient it actually pulls up in, I couldn't believe that. It was just, how many buses do you know that will actually pull up right into where you work at? Veterans program bus ride allows me to keep this job and come back and forth to work. It's a cost that I don't have to worry about, consider, and it just makes me happy that I actually there to provide it for the veterans.
Yeah, we really like Kevin. He's a good addition, and I'm glad he could ride the bus for free, because if he couldn't, we'd have to put up with somebody else, and Kevin's a good worker.
All right, so as you can see, every year the numbers have gone up as far as how many veterans are riding the bus service. We started in 2021 with around 40,000, and this year we are on track to do over 60,000 rides with Wichita Transit. Just keep in mind that you must show your veteran ID card at the time of boarding. Next slide, please. So I went ahead and included some of the easiest ways to get to the VA. Those of you that are familiar with it or not familiar with it, there's a queue line that runs from around Riverfront Stadium, just across the river there by downtown. And that, if you get on there and take that on Douglas, that will bring you all the way to the VA. And I believe that the queue line is actually free. So if you're riding with family, caregiver, someone like that, you would be able to ride the queue line for free. And again, that goes all the way from Riverfront Stadium to the VA. And as you can see here, it does stop several times at the VA. Next slide, please. Also, the bus system does run to our VBA offices, our new offices on East Douglas. As you can see, it stops right there in front of the VBA and East Douglas at the YMCA. Please keep in mind that all of the green grass in the streets there in front of the VBA, that's actually the parking area. So it's not a whole nother street or anything like that. It's just how the map lays it out. So, and I've also been told by Wichita Transit that if they can, they will pull up as close as they can to the front of the VBA. For those that, maybe in a wheelchair or a scooter or something like that, or not able to travel long distances. They did say that you will want to use the Town East Route 29 outbound times, which you can see are included in there as well, to help you get around. So that is all I have for now, Mr. Kimball.
Thanks, Charles. Great information. We've been talking about access, whether it be providing access in remote areas or improving satisfaction, but providing access to our veterans. I think you could see the benefit to some of the veterans just through the video that was provided. Great job, by the way, to our medical media team for putting that together. But what a great program, and it's obvious that it's been an important thing as it's been renewed through 26. So improving the facilities plays a big part in better access and nicer accommodations for our veterans. So today, Deputy Chief of Facilities Management Conrad Pierce would like to show some of the progress on different projects here at our facility. Conrad?
Hello, everybody. Like Gene said, my name is Conrad Pierce. I'm the Deputy Chief of Facilities here. Go ahead, next slide, please. All right, so first project up here, we've got our 3 East Med Surge patient privacy. So we had some issues with the HVAC air handler and making sure that it would meet our new pandemic standards based off of some things that we learned out of lessons learned from COVID. We are in the current process of doing a redesign. We had the first redesign submission reviewed this week, actually. We gave the AE team the comments and things back in order to make sure that we're getting the right equipment selected to replace the air handler, as well as we're going to have to do some work up in the new space to make sure that we are protecting our veterans and providing good quality cooling and heating for the new space that has new rooms, new private restrooms for every single veteran that will be here receiving care. Next slide, please. Our installation of new boilers. So this project is on the backside of campus. A couple pictures here. We've got the installation of our boilers, the installation and fabrication of our makeup water tank, and then that's the main distribution header there on the right-hand side. Go ahead and hit enter, and my animation should work to show you what it looks like now with our boilers installed and some of our controls work that we've started going through. Oh, sorry, go back one more slide. There we go. So currently we are on schedule for the end of this calendar year to be completed with the project. Commissioning and startup, we're going to be starting that here in May. And it will also right size our boiler plant to go into the future with all the new square footage and additional services that we're trying to bring online to provide care to our veterans. Next slide, please. Renovate and repair of our structural building 4. So this remodels ground floor, first floor, and the second floor of our historic building 4, as well as does some exterior work there, as you can see in the middle picture, where we are repairing and upgrading our stone staircase coming up into the building. This will help to right size our space for prosthetics, as well as redo some of their lab services down there for their fabrication of different prosthetic devices. We have the new schedule now, and we're looking like December of this year that we'll be complete with this project as well. Next slide, please. EHRM infrastructure and training spaces. So EHRM infrastructure and the training spaces to support it. EHRM is our electronic health records management project, which it basically is going to upgrade the infrastructure in order for us to have digital records back and forth and be able to more effectively handle and safeguard patient records. The infrastructure, that's a little bit farther along now than 85%. We're more looking about 90 to 95% complete. And the EHRM training and admin support space now is more along 95 to say 98% complete. We're pending one small modification on training spaces and then the final inspections and punch lists. Next slide, please. New construction awards. So as we mentioned earlier, women's veterans health is a big thing coming up and a big initiative and push that we're doing. And currently we are in some construction for Renovate Building 26 for women's health. Like it says there, 25,000 or 2,500 square feet of existing space is going to be remodeled to relocate the women's veterans program and be able to have access right across from the current women's clinic. This will hopefully be better to serve our population of our women veterans. Infill of Building 26 courtyard. This project was also recently awarded, and it adds 2 floors to the inside courtyard of Building 26. It does a whole lot of things for the police, medical surgical specialties. It also gets us some more exam rooms and will help to right size our dental space and update our canteen services that we have down there currently on the ground level of Building 26. Next slide, please. And that is all I have. Pending any questions, thank you all very much.
Thanks, Conrad. For those of you who don't often come to the VA here at the Dole VA, you don't see all the construction projects that take place around here and the coordination that these guys and gals do for us. So great job. Lastly, but definitely not leastly, our Veterans Benefit Administration Regional Office provides outstanding services to our veterans, and they were wanting to provide information today. So Maurice Cox, the Veterans Service Center Manager, is here to discuss a few things. Maurice?
Right, good afternoon. I'm really pleased to share some information with y'all. Keep in mind, first, the VA wants you to still file a PACT Act claim. The PACT Act is perhaps the largest healthcare and benefit expansion in VA history. And as Ms. Thompson highlighted earlier, this law expanded VA healthcare and benefits for veterans exposed to burn pits, Agent Orange, and other toxic substances. Next thing I want to talk about is the VBA record-breaking year thus far. VBA is on track to complete 2.4 million claims this fiscal year. That's the most we've ever completed. As a matter of fact, VBA surpassed FY23 production on July 18th. On Monday, July 22nd, VBA broke a record by completing 2 million claims for the first time in VA history. And here in Wichita, we're on track to complete over 12,000 claims. So where can you file a claim? Come see us at the Ruffin Building next to the East YMCA. We're at 9111 East Douglas. You can come over and visit with your veteran service officer, or you can come and see us at any of our outreach events. As you can see on the slide, some of the upcoming outreach events would be the first off, the Veteran Expo. Okay. The Veteran Expo First thing to note is the location change. In previous years, it had been hosted at the Mid-America All-Indian Museum. It is now at the WSU Metroplex this year, which is at 5015 East 29th Street North. There you'll have the opportunity to meet and learn about more than 60 community programs that serve veterans. And now, in addition to these booths, there will be VA mobile units and reps. WSU will have educational resources. There'll be military recruiters, food trucks, and guess what? We'll love to see you all there. Also, August 15th, we have a Veterans Claims Clinic in Hays, Kansas. At this event, Northwestern Kansas veterans, family members, survivors will all have the opportunity to file new or check existing claims. You can also visit with VBA staff members and examiners. Now, here's the great thing. Depending on the type of claim submitted, this clinic will have resources available to provide a decision the same day the claim is filed. That claims clinic will be held at the Hilton Garden Inn from 9 a.m. until 5:30 p.m. So if you need assistance or have questions about your benefits, please feel free to schedule an appointment with our phone team by scanning the QR code on your screen. Thank you all. Have a fantastic day. And the floor is yours, Mr. Kimball. Thank you.
Thanks, Maurice. Great information. I know that the Hays Claims Clinic is something pretty special since there will be decisions made that day. Been discussion around here about that, so good job. So that brings us to the question and answer portion of our program. Let's first address any questions we received through the team chat. I've kind of been watching that, and unless there was a question that was in there that I didn't see, we would open the floor. If you have a question, would like to unmute yourself, feel free to ask your questions. Okay, with no questions, next slide. So if you would like a copy of today's presentation, please send an email to me at gene.kimball@va.gov. That's all we have for today. Thanks for joining. We hope to see you here at the Dole VA or any of our CBOCs, or we will see you the next time at our Veterans Town Hall event. Thanks a lot. Have a great day.